Are you preparing for a home health survey? In this video, we break down some of the most frequently cited deficiencies in home health care, along with the common triggers that surveyors look for. Whether you're an administrator, director of nursing, QA nurse, or new to home health compliance, this guide is packed with actionable insights to keep your agency survey ready at all times. Let's jump in. Here are the most cited home health deficiencies and common survey triggers. Individualized plan of care, tag G574. The agency failed to include all required elements of the plan of care. Common survey triggers related to tag G574. Plan of care not updated or re-reviewed at the 60-day mark. Plan of care changes not reflected in the documentation, e.g. after rehospitalization. Physician signature missing or late. Disciplines providing care based on outdated plan of care. No evidence of consultation with the physician. Missing medications or vague medication orders. Home health aide providing care not included in the plan. Frequency listed as needed with no clear triggers. Services provided, like PT or MSW, not supported by orders in the plan of care. Plan has not been reviewed or updated at the recert interval. No physician signature or signature is late. Plan of care management, tag G572, for documentation or development of the care plan. The agency failed to ensure that each patient received the home health services that are written in an individualized plan of care that identifies patient-specific measurable outcomes and goals, and which is established, periodically reviewed, and signed by the certifying physician or allowed practitioner acting within the scope of his or her state license, certification, or registration. Common survey triggers related to tag G572, missing or vague orders, e.g. assist with ADLs without specifics, failure to update plan of care after hospitalizations or medication changes, disconnected team communication. Visit schedule, tag G614. The agency failed with the visit schedule, including frequency of visits by home health agency personnel and personnel acting on behalf of the home health agency. Common survey triggers related to tag G614, services provided without orders or beyond ordered frequency, no documentation for missed visits or refusal, home health aide providing visits not coordinated with the skilled services, gaps in visit frequency without clinical justification or MD involvement. Coordination of care, tag G614. The agency fails to adequately coordinate care among all disciplines involved in the patient's treatment. Common survey triggers related to tag G614. Conflicting documentation between nursing and therapy, missed or overlapping visits due to lack of team communication, lack of evidence of case conferences or interdisciplinary communication, a review of all current medications, tag G536, missing dosages, frequencies, or incomplete med lists. The agency failed to ensure that the comprehensive assessment included a review of all medications the patient is currently using in order to identify any potential adverse effects and drug reactions, including ineffective drug therapy, significant side effects, significant drug interactions, duplicate drug therapy, and non-compliance with drug therapy. Common survey triggers related to tag G536. Medication list incomplete or missing over-the-counter medications and supplements. No documentation of a clinical review of medications, only a medication list, side effects or duplicate therapies not addressed. Medication changes not followed up with MD. Oxygen not included on medication profile. Patient confusion or non-compliance with no intervention. No RN documentation of having done a medication reconciliation at start of care, resumption of care, follow-up, or recertification. Documentation of a medication taken by a patient but not present in the medication profile. Conformance with physician orders, tag G578, not adhering to physician directives. The agency failed to conform with physician orders. Common survey triggers related to tag G578, visit frequencies not matching plan of care. Wound care or treatment not completed as ordered. Medications or treatments changed without a new order. Labs not drawn on schedule. Verbal orders not followed up in writing or not signed by the ordering physician. PRN orders used without a clear trigger or documented justification. Infection prevention, tag G682, deficiencies in implementing effective infection control measures. The agency failed to follow accepted standards of practice, including the use of standard precautions to prevent the transmission of infections and communicable diseases. Common survey triggers related to tag G682. Staff unable to explain infection control procedures. No documentation of infection risk on the plan of care. No documentation of annual infection prevention and control training. Infection log not maintained or reviewed. Staff not using gloves or practicing hand hygiene. No infection control audits or investigation of incidents. Infection prevention and control program is generic or doesn't reflect current practices. Equipment such as BP cuffs, pulse ox, not cleaned between patients. Outdated or missing policies related to COVID-19 or other airborne precautions. In-home caregivers not educated on precautions or hand washing. Cross-contamination. No barrier field used for nursing bag laptops placed in dirty areas. Provide services in the plan of care. Tag G710. Failure to deliver services as specified in the patient's care plan. The agency failed to provide services that are ordered by the physician as indicated by the plan of care. Common survey triggers related to tag G710, services listed in the plan of care not delivered, e.g. Aide services skipped regularly. Therapy goals or interventions not being addressed in visit notes. Visit frequency lower than ordered without justification or MD update. Wound care or injections ordered but not documented in nurse notes. No documentation of physician communication when deviations occur. Services provided only as ordered by a physician. Tag G580. Services delivered without proper physician authorization. Common survey triggers related to tag G580, services initiated before order was obtained. PRN interventions done without documented physician parameters. Therapists modifying exercises or goals not reflected in the plan. Home health aid tasks performed that are outside what the MD ordered. Orders implemented late with no justification or MD communication. Promptly alerting physicians of changes, tag G590, delays in notifying physicians about significant patient condition changes. Common survey triggers related to tag G590. No documentation of MD being notified after a fall or hospitalization. Notes reflect clinical decline, but MD contact is delayed or missing. Care plan clearly needs revision but hasn't been updated. Surveyor asks staff about protocol and they don't know when or how to notify the MD. Communication is verbal only and undocumented. Supervision of home health aides, tag G442. Supervisory visits are not conducted as required, at least every 14 days, or supervision lacks adequate documentation of aide performance and care provided. Common survey triggers related to tag G442, missing aide supervision visit notes. No record of patient input or care assessment during supervisory visits. Documentation does not align with aide's plan of care. Emergency preparedness training and testing requirements, tag G1012 and tag E0039, non-compliance with emergency preparedness protocols, failure to properly train staff or conduct and document emergency preparedness drills annually. Common survey triggers related to tag G1012 and tag E0039. No proof of staff participation in drills, incomplete emergency plan documentation, lack of risk assessment updates, only conducting one exercise per year instead of two. No full-scale or community-based component. Tabletop exercise is undocumented or too informal. No after-action reports or improvement plans, emergency preparedness test not reviewed with staff, exercises not conducted within 12 months of the last one. Here are other frequently cited violations. Self-reported incidents of abuse, neglect, and exploitation. The agency failed to immediately report to the state within 24 hours knowledge of an alleged act of abuse, neglect, or exploitation of a client by an agency employee, contractor, or volunteer. Quality assessment performance improvement. The agency failed to maintain and annually review a QAPI program that was ongoing, focused on client outcomes that were measurable, and to include a written plan of implementation consistent with state requirements. The agency failed to make sure its Quality Assessment and Performance Improvement Committee met at least twice a year to address identified problems and concerns in service delivery. Management responsibility. Supervising nurse. The supervising nurse or the alternate supervising nurse did not ensure that care was provided according to a client's needs as written in the plan of care. Administrator. The administrator failed to manage the daily operations of the agency. Client records. The agency failed to have an individualized plan of care in each client record and/or failed to meet specified requirements for the information included in each of these plans. Personnel requirements for a survey. The agency failed to provide a surveyor entry to the agency to begin a survey within 2 hours of when notified of the surveyor's arrival during regular business hours, or failed to designate an agency representative who could grant the surveyor entry to the agency to conduct a survey. Agency cooperation with a survey. The agency failed to consent to entry and survey by the surveyor to verify compliance with the statute or this chapter. Verify employability. Use of unlicensed personnel. The agency failed, after the initial verification of employability, to search the nurse aide and employee misconduct registries at least every 12 months for an unlicensed employee with face-to-face client contact who was most recently hired on or after September 1st, 2009. Continuing education in agency administrator. The agency's administrator or alternate administrator failed to complete 12 hours of continuing education in the required topics within each 12 months in that job as required for the position of the administrator or alternate administrator of an agency. Thanks for watching. For more videos like this, be sure to subscribe. If this video was helpful, hit the like button. It helps others find it too. For a detailed 50-page PDF file on how to prepare for an initial survey, or if you're looking for other helpful downloadable digital resources on home health management, visit my Etsy shop. Link provided below. For questions and insights, drop a comment, and if you know someone who could benefit from this video, feel free to share. See you in the next one.